Hello, and thank you for taking your nursing education further with this quick review. Blood cultures are a critical test used in the diagnosis of patients with suspected sepsis and to determine if a patient has a bloodstream infection, also known as bacteremia or septicemia. Ideally, the collection of blood cultures should precede the initiation of appropriate antibacterial or antifungal therapy. Remember to assess a patient for SIRS criteria within 2 hours of starting your shift. Best practice is to assess for SIRS during your vital signs assessment. What does a positive sepsis screen mean? Answer: a positive sepsis screen means a patient has 2 or more SIRS criteria plus a known or suspected infection. An example of this would be a patient admitted for UTI who now has a spiked temp and a heart rate of 110 beats per minute. The MD orders a new set of blood cultures. You will need 2 sets of blood culture bottles. The blue top bottle for an aerobic blood draw. The red top bottle for anaerobic blood draw. You need a tourniquet. 70% alcohol swab. Chlorhexidine. A butterfly set. Clean gloves. And dressing gauze. Let's review more. Why are 2 blood cultures required from 2 sites? Answer: this helps to distinguish true bloodstream infection, in which both specimens will be positive with the same organism, versus positive results from contamination. How much blood specimen do I need to collect? Answer: you will need at least a minimum of 5 ml in each bottle. Which bottle do I draw first? Answer: first, remember, the aerobic or blue bottle is for bacteria that can survive with air, whereas the anaerobic, red bottle, is for bacteria that can't survive in air. You will draw 5 ml of blood in each bottle. If you have a 10 ml syringe full of blood, then split it in 2. You will draw the aerobic, blue top bottle first. Blood cultures should always be collected first. If other tubes are drawn first, they may contaminate the needle on the collection set and then contaminate the blood culture. How long do I have to scrub the bottle top? Always use a separate alcohol pad to clean each bottle. Scrub for at least 15 seconds to keep the process sterile. Allow to air dry. What type of collection technique is used? Answer: aseptic technique. Do I shake the collected specimen in the bottle? Answer: no. Invert the bottle slowly to gently mix the sample. What do contaminated blood cultures result in? Answer: it can result in increased length of stay, increased cost of care, MRSA, and invasive procedures. As part of the Joint Commission's patient safety standards, do make sure to confirm the patient's name and date of birth prior to beginning the procedure. You need to label each specimen bottle with the patient label, date, time, and the site of collection. Please specify which arm was used. If drawing from a CVC line, indicate which color port was accessed. Finally, the initials of the person collecting. If you have any other questions, simply call your facility's lab as a resource. Thank you for watching this quick review. Please like and subscribe to our channel.